Hello, viewers. You're watching the Policy Times, India's only channel on public policy and foreign affairs. The world is undergoing a severe crisis. COVID-19, Corona, started from China. Now, uh, there was a time when China was the epicenter, which then shifted to Europe, Italy, Spain, Germany, France. They were the most hard hit countries in the world. Now, the epicenter is shifting to United States. As we are talking now, the figure in globally is 500,000. It has crossed 500,000 figure today, and per hour the way the numbers are rising, I think by tomorrow it will cross 600,000, and maybe in a week it will cross a million figures. So these are all figures which are coming to in front of us. The death figures, the numbers of death are equally rising, which is equally scary. We are connected with Danial Bray, who is a principal engineer at Johnson and Johnson Vision, working from Bay Area in California. Primarily, he's from New York. Daniel, welcome to Policy Times, straight from New York, California.
Hey, how are you?
Thank you. And we just want to know the numbers, as I mentioned. It's really scary, and it's going up, it's growing. What are the reasons? What went wrong? And why are the numbers rising in US?
I think the one thing is when the initial spread started happening, I don't think most people took it as seriously as they should have. That's one problem. I think the other problem is I think this virus seems to be a lot more contagious than I think has been represented to us. So it's amazing how quickly it is spread. I think the other thing that's hurting, particularly people in the United States, is um, we can travel great distances. We fly a lot. We're not just in one. There's so many people that aren't just stay in one area, and so I think cutting off the domestic air travel uh, is another big part of trying to get this thing under control. So
As
that's where we are right now.
keeping the finger crossed, the state-wise numbers, if we say New York has almost crossed 37,000 cases, infected cases, with more than, I think, a couple of hundred deaths, followed by, I think, California is somewhere, Florida and other states are also equally, the numbers are increasing. So I want to ask that United States has just passed almost $2 trillion healthcare package to save and to fight corona. What is happening there? How is this government's healthcare schemes helping in terms of controlling fighting the disease? And what are the health companies doing out there?
I think the one thing about that bill that is the most important part of it is they're extending unemployment benefits to a lot of people. So I think that's good in terms of trying to keep people home and keep them, away from, large group gatherings and stuff. So that I think is very helpful. I'm not sure how that spending package is going to improve the medical response. And I have to say, I'm kind of surprised at how unprepared our health system was in terms of providing basic personal protection, equipment to our healthcare professionals. It was a real shock that you know so many of these critical things like masks and gowns and all of the stuff that you think they would be stockpiled, that they are in short supply. And I'm just amazed. Um, that's sad, and I know that it's going to be even worse in India.
Yeah, so I'll come back. Situation. The numbers are also rising in India. Uh, what I wanted to know that I was just hearing a radio channel which said that 3 million people have already filed unemployment in United States, and that is also, I mean, from here it's going to get more scary. So unemployment is one issue, but the issue is the industries are shut down, and so is the business. In such a situation, while Trump will have to address that, but the bigger issue would be how much of this money are being used, and how is the private sector also responding to this crisis, private healthcare companies especially.
I think all the U.S. healthcare companies and certainly the ones around the world, we're really working very hard to try to find vaccines for this virus. But everything that I've seen says, and this is not my expertise, but everything I've seen says, that those those solutions are probably at least 12 months away. So what do we do in the meantime?
Right.
That's really troubling.
Absolutely.
So I think the social distancing uh, can be very effective, and I think like in America, many people can work from home, which has been really really beneficial in terms of keeping things going. But there are a lot of people who their job day to day is to go out and drive trucks and stock shelves and build things, and those are the people I think that we really have to protect in terms of providing unemployment benefits, extending those, so that people can, when this finally does subside or get solved, that we're in a position to I think recover quickly. And I'm hoping like all foreign governments are also trying to protect people, and so that they don't get displaced from their homes, and because I think that would be a real tragedy.
I see. Daniel, we have seen from the World Health Organization data, the numbers in New York is high. New York has witnessed 37,000 plus cases. Uh, can you educate us why the number is high in New York?
I think one of the main reasons for that is that New York has been pretty aggressive at diagnosing these cases, and I think so. You're getting, I think, a better reporting number than you are in many other places in the United States. So I think the numbers that are being reported in New York are closer to being accurate than I think almost anywhere else. So that's part one. I think part two is that because this virus has spread so quickly, uh, places like New York are, particularly around Manhattan, are pretty hard hit because they've got a very effective mass transit system. So a lot of people moving through a lot of common places regularly, I think helped it spread pretty quickly. So those are two of probably the main reasons. But I think at the same time, um, I have friends in New York City right now, and people there are taking it very, very seriously now. Maybe they weren't originally, but now they are, and people are being very careful in terms of limiting their contact. Um, so I expect to see it get better soon. If it doesn't, that's going to be very troubling.
Yeah, we also expect New York soon recover from it. The other angle, you are in California. What the researchers are saying that the numbers in California right now is around close to 3,000, less than 3,000, but it can go up to 25,000 in coming 2 weeks. How is the local leadership, local political leadership responding to this? And are the hospitals and local healthcare centers ready to take 25,000 cases?
I don't know anything about the hospital capacity, but I think the hospital capacity in the United States in general is quite a bit lower than I ever knew before all of this happened. So, their ability to respond to any emergency has been maybe not as good as I would have expected. Uh, but I know that right here in the Bay Area, um, people have been staying home. What is this about? It's almost 10 days now that we've been all pretty much staying home. And when you go out to look at the highways and the roads, which are normally a traffic jam, they're empty. So I think people are taking this very seriously. And I'm not aware of any. I don't know of anybody here that actually has the virus that I've heard of. So I'm hoping that we're nowhere close to the 25,000 that you're stating. And I think that
That's
if we continue this for another couple weeks, it should be okay.
it should be okay. So Daniel Bray from straight from Bay Area, California, giving us an account of what is going on in the United States. And as against the research which says that the number can go up to 25,000, Daniel believes that the way things are going in California, they will be able to contain this number. Thank you, Daniel, for giving your comment on this. And we'll
All
be
right.
back with another story with another experts on it. You are
All
watching the Policy Times.